This season, rather than madness, opening days, or taking a break, the world is frozen, silenced by quarantines, isolated by distance, and edging on panic. But while work for you may have changed, out here, we're still going strong. Our season is underway. The crops will get planted, the livestock will be fed, and your food will continue to be grown. Just like it's been for generations. There's plenty to worry about. But out here, social distancing is our specialty. American agriculture, farms on, today and tomorrow, for our family and yours.
Hello and welcome to Farm Journal Live. I'm editor Clinton Griffiths from the Farm Journal Newsroom here in northern Indiana as we continue to track the latest developments in the coronavirus outbreak and its impacts on agriculture. Let's get straight to the headlines today as we continue to monitor the nation's food supply. An increasing number of meat processing workers falling ill with coronavirus, and that's raising concerns. There could be shortages of beef, pork, poultry at the grocery store. This after one of the largest pork processing facilities, the Smithfield plant in Sioux Falls, South Dakota, announcing it was closing until further notice. Now with 438 workers testing positive for the virus. Now on the beef side, JBS USA has closed a plant in Greeley, Colorado until April 24th. The plant slaughters about 5,400 cattle a day. That's about 5% of the total U.S. daily slaughter. JBS also shutting a beef plant in Souderton, Pennsylvania until April 16th. National Beef suspending a cattle slaughtering operations at an Iowa premium beef plant in Tama until the week of April 20th. That after numerous employees there testing positive for the virus. An Aurora packing company closed a beef plant in Aurora, Illinois. That's not including, obviously, all of the pork and poultry closures around the country. Let's bring in Colin Woodall with the National Cattlemen's Beef Association. And Colin, we've been following this very closely. This is one of the things we were concerned about with this coronavirus. Where do we stand right now?
We need to make sure that everybody understands that we do not have a shortage of beef.
Absolutely.
We have a lot of product in cold storage that is ready to go to retail. And it's also important to remember that about 50% of our production was going to food service anyway. And with the significant reduction in food service, that means more of it is available for retail. So we don't have a situation where we have a shortage, but it is something that is having a huge impact on prices because as we lose capacity, lose opportunity to get cattle into these plants to be harvested and processed, and therefore the negative impact on prices has been dramatic.
You know, some of the images we've seen obviously around the country as we go to these retail operations are empty store shelves and people, you know, trying to get enough supplies. Of course, that was early on. Things have changed over the last couple of weeks, but really it's about reworking our entire supply chain. The stuff that was going to retail now going to fast food and to food operations, now our restaurants now having to go into grocery.
That's right. Those first couple of weeks, we actually had to relabel those products because the labeling systems are different between food service and retail. So it took some time to retool everything, but we were able to achieve that. And as such, the packers have been able to focus everything on retail and to be able to keep that supply going. But again, between that and the cold storage supply that we have, we're not expecting any shortages out there. We definitely don't have a shortage of cattle. The protein's there. The challenge will be over the next couple of weeks getting them processed. And the good news is, unlike what we saw last summer with the Tyson plant, these are 2-week closures. And we believe that we can manage through these 2-week closures.
Talk a little bit about that for us, Colin, because, you know, a couple weeks at a time. I know the hog industry, the poultry industry works at a little different time scale than a lot of our cattle folks. Walk us through where we sit as far as kind of managing the next couple of weeks to 3 weeks.
You bet. Well, it's not ideal, but we do have a few more options available to us compared to our friends and the other proteins, because we can put those cattle on a maintenance ration in the feedlots. We can turn cattle out into the pastures. All of that, of course, comes with a cost, but we can at least hold on to those animals and try to get through this. Of course, we're also looking at other plants to see if plants can absorb some of the excess cattle here, but we are seeing plants across the country that are slowing down their speed. So this is becoming a nationwide issue, but we're going to manage through it And again, knowing that these are going to be 2 weeks at a time helps us better plan for that rather than some sort of indefinite closing.
You know, this time of year, we're talking calving season. We're talking, finding stockers we can put out on grass for the summer. Where do we sit as we look at the markets? Because that's obviously a big concern and something I know NCBA has been talking with the folks at USDA about what maybe a CARES Act package might look like for the livestock industry.
Well, there's two things. One is the money that we were able to secure in the CARES Act for a disaster stimulus package for cattle producers. We do expect that to be rolled out either late this week or first thing next week. But the second side of that is the request that we made to President Trump for USDA to expand the investigation that they had started last summer after the Tyson fire in Holcomb to include what we're seeing now during this COVID crisis, to determine what kind of market influences are out there, to see if there has been any manipulation, and try to help us identify ways that we can better capture that retail value and get it into the hands of producers. And we believe the investigation is the best way to move forward in order to achieve that.
You said maybe later this week, first of next week, we might hear kind of what's in that package. I know your folks were doing some work on what that might look like, given that livestock don't generally fall into those types of categories. Any indication what that could be?
Yeah, that's right. We didn't have a model to be able to just take and try to fill in the blanks. We've been able to, or we've tried to craft this from scratch. And we went to several ag economists at land-grant universities. We utilized some market analysts to help us get that package together. We have submitted that package to USDA. And Secretary Perdue told us last Friday that he wants to get this done as quickly as possible. So I think as soon as they get the parameters put together here this week, we could see the rollout. And then we'll make sure that we are doing a good job of talking to our members and all cattle producers on what they have to do to go forward and to apply for those monies.
All right, appreciate the insight as always, Colin. Thanks so much. Wish you the best there in Washington, D.C. as we deal with this coronavirus outbreak. Let's get on to some other headlines here. Just how big of a financial impact could the coronavirus have on agriculture? Well, the Food and Agriculture Policy Research Institute at the University of Missouri has come up with some new numbers. Economists there reporting that the ag sector could see a drop of up to $20 billion in net farm income. And running those numbers, they say the COVID scenario results in a 5 to 10% reduction in crop prices. There could be an 8 to 12% reduction on livestock sector prices. It says partially offsetting the drop is an increase in government payments. Now, while we worry about the impacts of agriculture and food supply, the outbreak continues. Many of the headlines focusing on larger cities along the coast, New York, California, New Orleans. The U.S. currently counting some 584,000 cases with 95,000 people hospitalized. But what about our rural hospitals? How are they holding up? Let's bring in Alan Morgan with the National Rural Health Association. And Alan, we checked in with you about 10 days ago. Where do we stand today?
Well, appreciate being back again today with you. So much has changed in the last 10 days. At that point, we really were talking about preparing and being in advance of it actually impacting rural America. Since that time, as of today, more than 20,000 cases across the United States in rural counties. So that's 3/4 of the nation's rural counties currently have COVID-19 positive cases. And we're tracking roughly 20 rural hospitals that right now are facing the surge, where their inpatient beds are full and they really are struggling to keep up on this. But for the vast majority of rural hospitals out there, it's unfortunately a wait mode. Many of them have had to furlough staff as they've rapidly reduced their inpatient, cut all their outpatient services and a lot of their elective procedures out of their mix.
You know, that seems like counterintuitive, right? Furloughing staff in the midst of a pandemic crisis like this, but without money coming in, that's where a lot of folks find themselves. Any pattern to what we're seeing as far as where these cases are popping up so far?
Yeah, I think even at this early point, there are three main areas that we're seeing. Number one, small towns adjacent to rural areas. Certainly outside of New Orleans and upper state New York are examples of that. The second being communities that are along interstate highways, where you've got a major truck stop that the town usually has some of its residents employed at. Batesville, Indiana is an example of that. And then, of course, what's made a lot of news are these resort areas, whether they're in Idaho or Vail, Colorado, where a lot of people have come in and really seeded these rural communities, unfortunately, with COVID-19. And Those are the three major areas that we're looking at for where we've seen this really severe impact happen.
What about equipment? Do we have enough equipment in these rural hospitals? I know we've been doing inventories and trying to make sure that we can have enough beds and ventilators and that kind of thing. In the last couple of weeks, how has the inventory counts gone? Do we have the equipment we need there?
Well, the easy answer is no. A more detailed look at it, though, I think what I'm hearing from the majority of the rural hospitals is that they have supplies on hand right now, but there's a real concern about are they going to have enough a week out, 2 weeks out? And the issue about ventilators, that really hasn't changed. The vast majority of rural hospitals have 1, maybe 2 ventilators on staff. These hospitals are primary care and general surgery. They're simply going to have to transfer out the patients if they start seeing a large influx of ICU patients.
Yeah, will be something to watch. What can we do to help? Is there anything that folks can be doing to be prepared or to keep our rural communities safe or to help out if their area does start to see a surge?
Yeah, number one, first and foremost, you please, from a rural standpoint, take this serious. Do it not just for yourself, but for your hospital staff. Isolate. Number two, most of the rural hospitals have patterns for masks and are really relying on local people to help sew masks and provide them as well too. That's really helpful. And then finally, I just want to say, be safe out there. If you're one of the farmer or rancher, don't take unnecessary risks. This is not the time to be plugging up the emergency room with accidents. So be safe, isolate. If you can sew, help in.
All right, we've seen a lot of great stories of young 4-H and FFA kids pitching in there to help with those masks. We'll continue to see that, I'm sure, in our rural areas. Alan Morgan with the National Rural Health Association, appreciate you so much for joining us and giving us an update today. As he mentioned, be safe out there. USDA does say that corn planting officially underway. 3% of the crop now planted. The 5-year average sitting around 4%. Both Illinois and Indiana have officially started. Missouri's at 4% planted. Don't forget, post your pictures or videos on social media by including the hashtag FarmOn. You can text FarmOn to 31313 and include your pictures or videos there as well. Thanks so much for watching Farm Journal Live today. I'm Clinton Griffiths. We'll continue to follow this breaking story. Remember, if you'd like to keep up on the latest news happening around the coronavirus, you can go to agweb.com/coronavirus for the very latest. Have a great afternoon.